All right, so you sent over some really fascinating articles about aspirin. Specifically, the idea that just taking like a low dose of aspirin every day would have like a massive impact on global health.
Right.
We're going to be diving into excerpts from a UK-based cardiology clinic's blog post.
Okay.
And then also a research article that was published by the U.S. National Institutes of Health.
Interesting.
And they both kind of touch on this idea that this super common over-the-counter drug could potentially prevent millions of deaths each year.
Wow.
Which is pretty impressive for something that you usually just grab for a headache, right?
Yeah, it really is. We're talking about a simple medication that's readily available and has the potential to make a huge difference in preventing some of the leading causes of death worldwide.
Okay, so let's start, I guess, by breaking down how it works.
Okay.
I know that aspirin can help with pain and inflammation, but what does that have to do with, like, preventing heart attacks or strokes?
So think about it this way. Our blood contains these tiny cells called platelets, and they're essential for clotting.
Okay.
So when you get a cut, platelets rush to the scene, and they clump together to stop the bleeding.
Right.
Which is great when it's an injury.
Yeah.
But inside our arteries, those clots can be super dangerous.
Oh, so like if a clot blocks blood flow to the heart,
Exactly.
that would cause a heart attack.
Yes.
Or if it went to the brain.
That's right, a stroke.
A stroke.
Yeah.
Wow. Okay, so aspirin, what does it do?
So aspirin acts like a traffic cop for these platelets.
Okay.
It doesn't completely stop them from doing their job,
Right.
but it prevents them from getting too sticky and forming those dangerous clumps.
So it's like aspirin is fine-tuning the clotting process to make it safer.
Exactly. A great way to put it.
And you were saying that a very low dose is enough to have these effects.
Yeah, just 75 milligrams.
Wow.
Which is only a quarter of a typical aspirin tablet.
That's incredible.
It's enough to significantly reduce the risk of those dangerous clots.
That's amazing. A tiny dose with potentially huge effects.
Huge effects.
One of the articles mentioned something called the Physician's Health Study.
Yeah.
And it sounded like that was a pretty landmark study.
It was.
That really put aspirin on the map for preventing heart problems.
Yeah. Back in the 1980s, the idea of taking aspirin daily to prevent heart attacks was pretty revolutionary.
Really?
Yeah. And the Physician's Health Study provided some of the earliest and strongest evidence that a low dose of aspirin could significantly reduce the risk of first heart attacks in men.
Wow. So this study, along with others that followed, I'm assuming, really cemented aspirin's role as like a key player in preventing heart attacks.
Absolutely, it did.
Particularly for those who've already had one.
Yes, especially for them.
So for someone with coronary artery disease, which I know is basically the buildup of plaque in the arteries, aspirin is now considered like a standard treatment.
Yeah, absolutely. It's also often prescribed to patients who have coronary stents, which are tiny tubes inserted to prop open blocked arteries.
Interesting.
And aspirin helps prevent clots from forming around the stent.
It sounds like aspirin's a true lifesaver for people at risk of heart problems.
Yeah, it can be.
But before everyone runs out to stock up, I'm guessing there's some caveats, right?
You're right. It's important to emphasize that while aspirin can be incredibly beneficial, it's not a one-size-fits-all solution.
Right.
It's not recommended for stroke prevention in people with a condition called atrial fibrillation, for example. As other medications are more effective in that scenario.
Gotcha.
And of course, there are potential risks to consider. Which we'll get into a bit later.
Right. So it's definitely not something to start taking without talking to your doctor.
Exactly.
Speaking of other benefits, one of the articles mentioned aspirin's potential role in cancer prevention.
Yeah.
Which I found really surprising.
Yeah, it is a newer area of research. Compared to aspirin's role in heart health. But it's incredibly promising. There's growing evidence that daily aspirin use might significantly reduce the risk of certain types of cancer.
Really?
Particularly colorectal cancer.
So not just heart attacks and strokes, but potentially cancer as well?
Potentially, yeah.
That's remarkable.
It is. And there was a 2016 study published in the journal PLOS One that used a really sophisticated model to project the long-term benefits of increased aspirin use.
Interesting.
Especially for Americans aged 50 and older.
And what did they find?
Their model, based on real-world data, estimated that wider aspirin use in this age group could actually add almost 1 million people to the U.S. population by 2036.
Wow, that's a huge potential impact.
It is, and it's not just about lifespan either.
Okay.
They also projected substantial overall health benefits, suggesting that wider aspirin use could lead to more years lived in good health.
Okay, so we've got this incredibly cheap, readily available medication.
Right.
With the potential to prevent heart attacks, strokes, and maybe even cancer. And potentially add 1 million people to the U.S. population by 2036.
It's amazing.
It's almost like a miracle drug.
It is pretty remarkable.
But I'm guessing there has to be a downside.
You're right. As with any medication, there are risks to consider.
Okay.
The primary concern with daily aspirin use is the risk of gastrointestinal bleeding.
Right, because it's essentially thinning the blood.
Exactly. And this risk is why aspirin is generally recommended for those at higher risk of heart attacks.
Okay.
Like people with coronary artery disease or a history of heart attacks.
Right.
For those individuals, the potential benefits likely outweigh the risks.
So it comes down to like a careful assessment of individual risk and benefit.
Exactly.
Are there any tips for minimizing the risk of bleeding for those who do take aspirin every day?
Yeah, one simple but important tip is to always take aspirin with food rather than on an empty stomach.
That makes sense.
That can help reduce irritation in the stomach.
What about surgery? Do you need to stop taking aspirin before a surgical procedure?
Not typically.
Yeah.
Which is an important point to highlight.
Okay.
Unlike stronger blood thinners, aspirin's effect is primarily on platelets, not the entire coagulation cascade.
Okay.
So it doesn't usually need to be stopped before surgery.
Okay, that makes sense. Okay, so we've covered the science behind how aspirin works its role in preventing heart attacks and potentially cancer.
Right.
And the importance of balancing benefits and risks.
Yeah.
Now, I want to get your thoughts on aspirin's potential global impact.
Okay.
The research we've looked at suggests that millions of lives could be saved worldwide if aspirin were more widely used for prevention.
It's really exciting to consider from a public health perspective.
Yeah.
Aspirin is a low-cost medication with a well-established safety profile. If we could harness its potential to prevent these major causes of death on a global scale, the impact would be enormous.
There's a statistic from the PLS1 study that really stood out to me.
Okay.
They found that over 40% of men and 10% of women aged 50 to 79 in the U.S. were identified as being at high cardiovascular risk, but were not taking aspirin.
That's a huge gap in care.
That suggests there's a substantial unmet need for preventive aspirin therapy, even in a developed country like the United States.
Absolutely. It raises some important questions about why this disconnect exists between the scientific evidence and real-world practice.
Yeah.
There are likely multiple factors at play.
Okay.
From awareness and access to physician practices and patient preferences.
Definitely a complex issue with a lot to unpack.
Definitely.
Okay, before we move on, I want to circle back to something we touched on earlier.
Okay.
The duration of aspirin's effects. I remember reading that it's not like a typical painkiller where the effects wear off after a few hours.
Right.
So how long do aspirin's effects last?
So aspirin's effects on platelets actually last for the entire lifespan of the platelet.
Wow.
Which is about 7 to 10 days.
Interesting.
So even after you stop taking aspirin, its effects can linger for a while.
Oh, wow. That's something to be aware of if you're having surgery or another medical procedure.
Exactly. Always inform your doctor about any medications you're taking, even over-the-counter ones like aspirin.
Good advice. Okay, let's shift gears a bit and delve into some of the specific insights from the UK Cardiology Clinic's blog post.
Okay.
They seem to be especially focused on aspirin's ability to prevent heart attacks on a global scale.
Yeah, they were. And what's interesting is that the cardiologist who wrote the post, Dr. Leatham, really emphasized that aspirin's benefits are most pronounced in people who already have coronary plaque buildup.
That makes sense, right?
Yeah.
Because aspirin is preventing those plaques from rupturing.
Exactly.
And causing a major blockage.
Yeah. He actually broke down the process of a heart attack into 4 stages.
Okay.
And highlighted that aspirin specifically targets the 3rd stage.
Okay.
The formation of that occlusive thrombus or clot.
So it's not preventing the buildup of plaque.
Right.
But rather the catastrophic event that can occur when that plaque ruptures.
Exactly. And that's why for individuals with existing coronary artery disease, the benefits of aspirin are likely to be much greater.
Interesting. So what about people who don't have any known heart issues? Should they be taking a daily aspirin just in case?
That's where things get trickier, and it really underscores the importance of personalized medicine.
Okay.
For the general population, the benefits of aspirin have to be weighed against the potential risks.
Right, like that gastrointestinal bleeding we talked about.
Exactly. It's all about risk stratification.
Okay. Dr. Leatham did offer one simple but important tip for anyone taking aspirin daily.
Oh, yeah. What was that?
He emphasized that it's always best to take aspirin with food.
Makes sense.
Rather than on an empty stomach.
Yeah, solid advice helps minimize any stomach upset.
You know, I have to admit, when I first started reading about the potential for a daily aspirin to save millions of lives, I was a bit skeptical.
Yeah, I can understand that it almost sounds too good to be true.
Right. But the more I learn about how aspirin works, the more I'm starting to see the logic behind it.
Yeah, it's all about understanding the underlying mechanisms.
And the evidence seems pretty solid, especially when you consider all the large-scale clinical trials that have been conducted over the years.
The sheer volume of research on aspirin is impressive.
It's definitely not some fringe theory.
Not at all. Aspirin's role in preventing heart attacks and strokes is well established in the medical community.
And now we're starting to see its potential in cancer prevention as well.
Yeah, it's amazing how this little drug keeps revealing new layers of benefits.
Before we wrap up this part of our deep dive,
Okay.
I wanted to circle back to something else we discussed earlier.
Sure.
Aspirin's impact on different types of blood clots. We talked about its benefits for arterial clots, the kind that cause heart attacks and strokes.
Yeah.
But what about venous thromboembolism, or VTE?
Ah, yes. VTE is a condition where blood clots form in the veins,
Okay.
typically in the legs. These clots can be dangerous because they can travel to the lungs and cause a pulmonary embolism, which can be life-threatening.
Exactly. One of the sources mentioned that while aspirin's impact on venous thrombosis is minimal, compared to its effects on arterial thrombosis. There might be a role for it in preventing VTE in specific scenarios, like during long-haul flights or periods of prolonged immobility.
That makes sense. Those are situations where blood flow can become sluggish,
Right.
increasing the risk of clot formation.
Of course, it's important to note that this isn't a standard recommendation.
Right.
And more research is needed to determine the effectiveness of aspirin in preventing VTE.
Always good to emphasize that.
But I thought it was a fascinating point to consider.
Yeah.
And it just goes to show that we're still learning about the potential applications of this versatile drug.
Absolutely.
Yeah.
The world of medicine is constantly evolving, and aspirin is a great example of how a seemingly simple medication can have far-reaching effects.
Okay, I think we've covered a lot of ground in this first part of our deep dive into aspirin.
Yeah, we have.
We've explored the science behind how it works, its potential benefits for preventing heart attacks, strokes, and potentially even cancer.
Right.
And we've touched on the importance of balancing benefits and risks.
Yeah.
And we've even delved into some of the nuances of its effects on different types of blood clots.
We have.
It's been a fascinating journey so far.
It has.
But before we move on to the next part of our deep dive, let's take a moment to really consider what all of this means for you, the listener.
Great idea. Let's bring it home.
We've seen that a simple, low-cost medication like aspirin has the potential to make a huge difference in global health.
Yeah.
Preventing countless heart attacks, strokes, and maybe even cancers.
The evidence is compelling.
But as we've emphasized throughout this deep dive, there are risks to consider.
Yeah.
And it's absolutely crucial to talk to your doctor about whether daily aspirin therapy is right for you.
Couldn't have said it better myself.
Now for a final thought to ponder as we wrap up this part of our exploration. If aspirin is so effective and inexpensive, why isn't it more widely utilized for prevention? What are the barriers? What factors might be influencing this disconnect between the science and real-world practice? That's something to mull over as we continue our deep dive into the world of aspirin.
It's a complex issue with no easy answers, but it's definitely a conversation worth having.
Absolutely. And on that note, we'll leave you to contemplate the fascinating world of aspirin and its potential impact on global health. Join us for part 2 of our deep dive, where we'll continue exploring this incredible medication and its implications for the future of preventative medicine.
We'll see you there.
Yeah.
Welcome back. I'm excited to continue our deep dive into this world of aspirin.
Yeah, there's still so much to explore.
Yeah.
In the first part, we talked about aspirin's potential impact, I guess, on global health. Now let's shift our focus to some of the key messages, I guess, specifically about aspirin's ability to prevent heart attacks. From that UK Cardiology Clinic's blog post. They really highlighted how aspirin works at a very specific stage of a heart attack.
They did?
To prevent a catastrophic event.
Yeah. Dr. Leatham explained it really well.
Yeah.
He broke down a heart attack into 4 stages. And aspirin specifically targets the third stage.
Okay.
The formation of that final artery-blocking clot.
So it's not preventing the initial buildup of plaque in the arteries.
Right.
But it's acting like a safeguard to prevent that most dangerous consequence of the buildup.
Exactly. Aspirin's role is to prevent the formation of that final clot.
Okay.
That cuts off blood flow completely.
Wow.
That's why it's so beneficial for people who already have coronary artery disease. It's like having a safety net in place in case one of those plaques ruptures.
That makes a lot of sense.
Yeah.
But what about people who don't have any known heart issues? Should they be taking a daily aspirin just as like a preventative measure?
That's where things get a bit more complex.
Yeah.
And it really highlights the need for personalized medicine. For the general population, the benefits of aspirin have to be carefully weighed against the potential risks.
Right, like the risk of gastrointestinal bleeding that we talked about.
Exactly. It's all about finding that balance between potential benefit and potential harm, which can vary significantly from person to person.
Right, and that's why it's so important to talk to your doctor.
Exactly.
They can help you assess your individual risk factors and determine if a daily aspirin is right for you.
Exactly.
The blog post also emphasized the importance of taking aspirin with food.
Yes.
Which seems like a simple but pretty important tip.
It is. Taking aspirin on an empty stomach can increase the risk of stomach irritation.
Okay.
So taking it with food can really help minimize that risk.
Before we started this deep dive, I had no idea how much research had been done on aspirin.
It's pretty impressive, right?
It is.
The sheer volume of research on aspirin's effects, both positive and negative, is really a testament to its importance in medicine. We're talking about decades of research involving large-scale clinical trials that have helped solidify our understanding of how aspirin works and who might benefit from it.
So it's not just some fringe theory.
Not at all.
Yeah.
Aspirin's role in preventing heart attacks and strokes is well established in the medical community.
And now we're starting to see its potential in other areas like cancer prevention.
Yeah, which is really exciting.
It really makes you appreciate the power of scientific inquiry.
It does.
And it speaks to the importance of staying informed about medical advancements.
Yeah.
Because even though aspirin has been around for ages, we're still learning new things about its potential.
Science is a constantly evolving process.
Yeah.
It's always fascinating to see how ongoing research sheds light on new applications for existing treatments.
So we've established that aspirin is a lot more than just a simple headache remedy.
Definitely.
It has the potential to be a game changer for preventing some of the leading causes of death worldwide.
It really does.
But this raises an interesting question.
Okay.
If it's so effective and affordable, why isn't it more widely prescribed or recommended?
That's a great question, and it gets to the heart of some complex issues within healthcare systems around the world.
Like what? What are some of the potential barriers to wider aspirin use?
Well, for one, there's the issue of awareness.
Okay.
Not all doctors may be completely up to date on the latest research regarding aspirin's preventive benefits.
Okay.
So there might be a knowledge gap among some healthcare providers.
So even if the research is solid, it doesn't necessarily mean that knowledge is being translated into practice consistently.
Exactly. Another factor is patient adherence.
Okay.
Even if a doctor does recommend daily aspirin, will the patient actually take it as prescribed?
Right.
Medication adherence is a challenge across the board.
Yeah.
And it's especially important for preventative therapies where the benefits may not be immediately apparent.
Right. It's easy to forget to take a pill every day when you're not feeling actively sick.
Exactly. And then, of course, there's the issue of managing potential risks.
Right.
As we discussed earlier, aspirin can cause gastrointestinal bleeding. That risk needs to be carefully weighed against the potential benefits.
Right.
Which can vary depending on an individual's specific risk factors.
So it really comes down to that personalized approach we talked about earlier.
Absolutely.
There's no one-size-fits-all answer when it comes to aspirin therapy.
The decision to take a daily aspirin should be made in consultation with a doctor.
Right.
Who can take into account a person's individual health history.
Yeah.
Risk factors and preferences.
One of the sources did highlight some specific groups.
Okay.
Who might benefit most from daily aspirin therapy.
Oh, which ones?
Well, they specifically mentioned patients with coronary stents.
Right.
As we discussed earlier.
Yeah.
Aspirin helps prevent clots from forming around the stent.
Exactly.
They also mentioned individuals who have already had a heart attack.
Okay.
Or what's called acute coronary syndrome.
Makes sense.
Yeah.
They're at a much higher risk of having another cardiac event.
Exactly. And they also highlighted patients with significant coronary atherosclerosis.
Okay.
Especially those with high-risk features like what are called soft plaques.
Yeah, that's where aspirin's ability to prevent clot formation becomes really crucial, as those soft plaques are more likely to rupture.
Right.
It's all about reducing the likelihood of a catastrophic event.
So for those specific groups, the potential benefits of daily aspirin therapy likely outweigh the risks.
Right. But again, it's a decision that should always be made in consultation with their healthcare provider.
It sounds like we've just scratched the surface when it comes to the potential applications of aspirin.
Yeah, we really have.
It's amazing to think that this little white pill, something most of us have in our medicine cabinets, could have such a profound impact on global health.
It really is remarkable. And it underscores the importance of ongoing research and scientific inquiry.
Yeah.
We're constantly learning new things about the human body and the ways we can use medicine to improve health and well-being.
Right.
Aspirin is a perfect example of that.
Absolutely. And it reminds us to stay curious.
Yes.
And to never stop learning.
Yeah.
Who knows what other discoveries are waiting to be uncovered.
Right.
Even with medications that have been around for as long as aspirin.
It's an exciting time to be alive.
Okay. As we wrap up this second part of our deep dive, let's leave our listeners with one final thought to ponder.
Okay.
If aspirin is so effective and affordable, why isn't it more widely utilized for prevention?
Yeah.
What are the barriers? What factors might be contributing to this disconnect between the scientific evidence and real-world practice? It's a complex question with no easy answers.
It is.
But it's definitely worth considering as you continue exploring the world of aspirin.
I completely agree. This is a conversation that deserves more attention. And we encourage everyone to continue learning, asking questions, and advocating for better health outcomes for all.
We'll be back for the final part of our deep dive into the world of aspirin shortly.
Okay.
Join us as we explore some more fascinating aspects of this remarkable medication and its potential to shape the future of preventative medicine. Welcome back to our deep dive into the world of aspirin.
It's amazing, isn't it?
It really is.
We're still uncovering new insights about this medication.
Right.
Even though it's been around for over a century.
It really speaks to the constantly evolving nature of medical science, doesn't it?
Absolutely. There's always more to learn.
Right.
And aspirin is a perfect example of how ongoing research can reveal new applications and benefits for existing treatments.
Absolutely. And it also highlights, I think, the importance of staying curious and informed.
Yeah.
In the last two parts of our deep dive, we've explored the science behind how aspirin works.
Right.
Its remarkable potential for preventing heart attacks, strokes, and possibly even cancer.
It is.
And we've touched on some of the complex factors that influence its use in real-world practice.
Yeah, we've covered a lot of ground.
We have.
And yet it feels like we've only scratched the surface.
Right.
Aspirin is a truly multifaceted medication.
Yeah.
With a fascinating history and an equally fascinating future.
I completely agree. So for this final part of our deep dive, I want to focus on a few specific points that I found particularly intriguing as we were reviewing the research.
Sounds great.
I'm all ears.
Okay, first up, one of the sources mentioned the idea of using aspirin to prevent venous thromboembolism.
Right.
Or VTE.
Yeah, VTE is a condition where blood clots form in the veins, typically in the legs.
Right.
And these clots can be dangerous because they can travel to the lungs and cause a pulmonary embolism, which can be life-threatening.
So the idea is that aspirin might help prevent these clots from forming in the first place.
Yeah.
Particularly in situations where blood flow is sluggish, like during long-haul flights or after surgery.
That makes sense. We know that aspirin helps prevent clots in the arteries.
Right.
Now, the research on aspirin's role in preventing VTE is still evolving.
Yeah.
And it's not a standard recommendation at this point.
Right.
But I found it fascinating to consider, especially given that VTE is a relatively common and potentially serious condition.
I agree. It's definitely an area where more research is needed. But it highlights aspirin's potential versatility.
Right.
And the possibility that we might uncover even more benefits as research continues.
Another point that really struck me was the concept of aspirin as a tool for global health equity.
Yeah.
We've talked about the potential for aspirin to save millions of lives worldwide, especially in low and middle income countries where access to advanced medical care is limited.
It's a powerful idea, isn't it?
It is.
Aspirin is incredibly affordable and readily available in most parts of the world.
Right.
If we could effectively harness its preventive power, it could have a transformative impact on global health.
Yeah.
Particularly in regions where heart disease, stroke, and cancer are major public health challenges.
It's almost like a low-hanging fruit in terms of global health interventions.
I agree.
We have this simple, inexpensive medication with a well-established safety profile that could potentially make a huge difference in preventing some of the leading causes of death worldwide.
It's a compelling argument for prioritizing access to essential medicines like aspirin.
Yeah.
And ensuring that healthcare providers and patients are aware of their potential benefits.
Absolutely. And it underscores the interconnectedness of global health.
Yeah.
What happens in one part of the world can have ripple effects everywhere else.
Very true.
So as we wrap up this deep dive into the world of aspirin, I'm left with a sense of awe at the power of scientific discovery.
Yeah.
And the potential for simple solutions to have a profound impact on human health and well-being.
Absolutely.
Who would have thought that this little white pill, something most of us have in our medicine cabinet,
I know, right?
could be so much more than just a headache remedy?
It's a testament to human ingenuity and our ongoing quest to understand and improve the human condition.
And it's a reminder to never underestimate the power of knowledge, curiosity, and the willingness to ask questions.
Beautifully said.
For all of you listening, thank you for joining us on this fascinating journey into the world of aspirin.
Yeah, thanks for listening, everyone.
We hope you've gained some valuable insights and perhaps even a newfound appreciation for this remarkable medication.
It's a pretty amazing little drug.
Remember, knowledge is power. Stay curious, stay informed, and always talk to your healthcare provider to determine what's best for your individual health needs.
Absolutely good advice.
Until next time, we'll see you on our next deep dive.
See you then.